Regular checkups and screening can lead to early diagnosis and successful treatment of cancer and other diseases.
Where are the men? A report issued by Northern Health confirmed that men in northern BC do not live as long as their counterparts in the Lower Mainland. It was time to take action, coordinating the efforts of groups across the region.
I lifted my bucket, but I didn't have a sand cake.
Anthony Colton reads to his 4 kids, a chance to sit and cuddle. These moments are precious to the Prince George area logger lately. A separation from his wife has led him to a decision to turn his life around and get healthy.
Just trying to better myself and, I don't know, trying to get more in touch with myself and, not trying to control other things around me. Right, I'm cowboy.
Anthony is taking part in Kikino's Warrior program through Métis Children and Family Services in Prince George. He's also enrolled in a 12-step program to deal with his addiction issues, and he's doing it with the support and help of other men.
If I didn't have the male support in my world, I probably wouldn't have made it this far.
Mike Speckin has been in and out of the Warriors group for several years, always coming back to work on his issues of unemployment and estrangement from his family. The group setting helps him to open up and provide help to other men.
I just think because we're maybe raised or taught to keep things to ourselves and, kind of just suck it up, like be a man. If we don't open up to ourselves and others, then we won't be able to seek the help that we may need.
The Warriors program is just one of many that offer men a chance to connect, socialize, and share with other men, an integral way to finding a good balance.
Men, generally speaking, aren't comfortable in an office one-on-one, kind of being not intimate, but in an intimate space with a healthcare provider, taking off their clothes and sort of talking about their problems. We're just not brought up that way. I mean, we grew up in sort of a schoolyard environment, many of us, where there's lots of bullying and you have to be tough and you don't cry. And girls grow up differently. I mean, and they're comfortable. The healthcare system is kind of their thing. So we've learned that in a lot of settings, men do better in groups.
Having a beer with the guys can be a healthy thing if moderation is practiced.
Now the men, you see, this is something that might appeal to a guy a little bit.
Communication lines open as men socialize with each other.
Men actually, and that's another myth I think that we're discovering, is that the idea that men don't talk or that they don't care about their health. They really do, but they sort of talk differently. They don't talk in the sort of same kind of mutually supportive way that women will talk. They tend to talk, a sociologist I ran into called it ironic teasing, where you put each other down, like, in a kind of a teasing buddy way. But that talk actually accomplishes bonding and sort of socialization and creates, networks and all that kind of stuff that socialization is supposed to do.
I'm in so much trouble, I'll tell you that right now.
Do you have a family doctor, Duane?
Duane Jackson is from the Kitimat of the Gitxsan Nation. He grounds his approach to men's health in Indigenous culture and early childhood development, and is a champion of the Northern Health Men's Health Program. He often speaks for those who are too uncomfortable sharing with others.
I think along the lines that there really aren't a whole lot of resources for men. And the idea around advocacy is just to speak for people that really aren't speaking for themselves, and as men we really don't. We tend to work through it, we wade through it, we tough it out, and in the end that way of doing it actually really fails us.
Admitting to having problems, whether mental or physical, seems to be a tougher thing for men to do than women.
One of men's biggest sort of fears is that fear of weakness or appearing weak. So, if you're in pain and you show it, that's the last place you want to be. I mean, the pain is sort of one thing, but being seen as weak, it undermines everything we're taught.
But the focus is shifting, and there are 5 areas being targeted to help the men get to better health.
Physical inactivity, if we can address that, we can make a huge difference. Unhealthy eating is another area that we needed to address. Thirdly, there was smoking. We still got some of the highest smoking rates in BC. If we can address that, that will improve health. And then particularly substance use, alcohol. It's just that we need to start looking at safe alcohol consumption. And then the other one is just risky behaviors.
Some of this work is done through the Men's Health website, which offers interactive tools, along with healthy tips and even manly recipes. The manual is another great reference tool, breaking health suggestions down into 3 categories. For the young dude, the dad, and the old dude.
We've got great information on how to increase your physical activity. We've got great modules on our manual, so you can take quizzes on the knowledge that you learn from the manual. We've got great videos of the different screening events that we've done in the past, because sometimes guys want to see what they're in for.
The conversation has been started, but what now for men living and working in northern BC? In Kitimat, the campaign is beginning to see some benefits, with a heightened awareness throughout the community and a comfort level coming from the men themselves to share and talk about their issues.
There's definitely a lot more chatter with men's health in our community now because of the information we have. We have ads that go in our recreation guide here in the community and stuff about, you know, come on men, get off the couch, get active, you know, go see your doctor, make sure you're being proactive kind of messaging. And so we are starting to see that being more of a normal conversation to have, where before it was something that was very almost taboo and like, I'm a man, I'm not going to talk about that.
And throughout the region, there are now many programs underway, with the initiative linking what was already taking place.
And our idea is not that we can deliver a men's health program that's going to change the world, but if we can link up with other groups that are already doing it or that are interested in it, especially the workplace settings, and First Nations communities. Like we've already found here that a lot of First Nations are already doing work, say around residential school healing and stuff like that, where the men are already gathering in groups talking about traditional culture and what the roles of men and women should be. And so we're just trying to link that together a little bit, provide, you know, resources and maybe legitimize this whole discussion around men's health.
Perhaps the biggest help comes from those who support and love their men.
Because he does special things.
Like what?
Well, one day when Mommy didn't even know, he gave me one of my heart lollipops.
What families can do is be supportive, and that's really what families are all about, is you know, having a lifestyle that supports this activity and just really being there for the men in their lives, as men are there for their families as well.
Focus on the family, simple as that. You know, priority number 1. Same as fitness, you know, I just put it all up there as a priority. Everything else has got to be, you know, work is important too, but number 1 is family, fitness. We go to church, try and live a good life.
I think we need to get away from the societal ideal of what a man is supposed to be. And in doing that, we're going to bring fathers back into the circle of the family and give them an understanding of the sacredness of their place there.
That we can start getting men to live healthier lifestyles. And secondly is that men can start on a regular basis, at least start visiting their physicians and for checkups, and just start getting into that habit. I think by doing that already, you are at least reducing your risk for disease in the future.
The work of the Men's Health Initiative in northern BC is groundbreaking. Designed by men for men, it's a new way of assisting the male population as they seek healthier and happier lives. Now, the rest of the world is shifting its eye to our region. The program is the first of its kind in Canada. Health professionals from North America are looking to Dr. Bowering and those spearheading the program to help improve the health of men in their communities.
This little health authority up in the north, we're seen as kind of leaders, and so we get invited to all the men's health stuff that's going on. It's pretty good.
Back in November of 2010, Dr. Bowering asked the question, where are the men? Today, the men are here, at work, at home, at play, working toward changing the numbers that point to higher cancer rates, suicide, occupational death, and chronic disease. Maintaining healthy lifestyles means those who look to dad, brother, uncle, grandpa, and spouse can continue to do so for more years than ever before.
Check out men.northernhealth.ca for tips and hints on how to live a healthier life. For more information about the Northern Health Men's Health Initiative, email menshealth@northernhealth.ca.